So thanks for joining us on this webinar. Okay, so the hot topic of healthcare and social media and about controlling message when you can't control the messenger. Just to go through quickly the agenda of what we're going to talk about. So first of all, I'm going to do a little bit of a background about what's happening in social and why healthcare can't ignore social. And then Barry's going to take us through 6 key considerations when you're developing a social media strategy. It starts with listening, then moves on to engaging, looking at your strategy, making sure your site's optimized, planning, and then of course reviewing.
The broadcast is now starting. All attendees are in listen-only mode.
Okay, so why healthcare companies can't ignore social media. So digital in healthcare is no longer seen as an emerging channel. At one point people thought it was far off and not relevant to me, but it's now a crucial part in the majority of multi-channel marketing strategies that we discuss daily with our clients. A difficulty still for many healthcare brands, however, is how to integrate creative social media into those Marcom's plans. Particularly with regulatory restrictions in mind, it's sometimes hard to be cutting edge. Okay, so here's a little bit of a map that shows us that social media is not going away anytime soon, and I think we can all think of our own experience that we're probably more social now than we've ever been. So some stats: Facebook has nearly 1 billion regular, strong and engaged users, and approximately 200 million of those are mobile only. So in other words, nearly a fifth of Facebook's user base don't use a PC to access their account. And really extraordinarily, YouTube reaches more adults than any cable network. So TV's not quite dead, but this is a recent research done in April. This is non-healthcare specific, but 48% of marketing budgets were spent on digital in 2013. And in that period, the expenditure on social media in particular was up by 63%. So how does that look in healthcare? So 50% of healthcare companies, and that will be across pharma, med devices, biopharma, OTC, have a social media budget. And 70% of those companies have said they are increasing their social media spend. So you can see there's really a reallocation of spend between brands and channels, tactics and audiences. Okay, so how does it look now? The healthcare sector is already heavily involved in social media and across various platforms. I'm sure all of you will have seen various sites run by the NHS, by big pharma brands who are condition related. There's lots of direct to consumer for OTC companies. Med device companies are talking direct to consumers now, and nurses and carers. And I'm sure you've all seen We Nurses Twitter feed, which is absolutely amazing insight for any healthcare brand. So social channels are connecting people who've got shared conditions, shared concerns and shared outcomes, and brands need to understand how they can listen and then get involved with these channels to build relationships with customers, stakeholders and all influencers. Simply marketing the magic of a pill or a cream or a dressing is now long gone, and it's now about everything else that surrounds that pill or cream or dressing, and that includes education about condition, real lifestyle advice, prevention guides, and social, we're finding, is a really great way to establish that support and relationship. But social's not just about engaging patients. The potential is there to create and empower communities, including HCPs, including GPs, nurses, and patient associations and carers too. Okay, so we looked at a typical journey for a patient with a chronic condition, and Barry will talk later about getting the right message to the right person at the right time. And I think key to doing that is to identify the potential for social media in terms of treatment journeys. So at what stages are people going to want to engage, and what are they going to want to engage about? So here's a bit of an outline of a typical journey of a patient, as I said, on that transition from acute to home. So obviously when you're first diagnosed with a condition or you're post-operation, you tend to be highly anxious, you feel confused, less empowered, you don't really know what's happening to you. And then you move through that transition period where you start to absorb information. You might start to look at new regimes and medication and understand how having this condition is now going to affect your life and maybe need to change your lifestyle, to the period when you're living with a condition. And this is the time when people tend to drift, and complacency comes in and non-compliance comes in as well. And I think there's different times as a brand where you need to think about your social message. Okay, so what we've done is we've overlaid here how the certain periods in that journey when we might be offering certain types of advice. So early on it could be reassurance, then you move into that support, establishing compliance behaviours, motivational messages at this time we found are really great. And then when you're confident and living with a condition, then you start to connect to other patient groups, forums, and then you're looking for support all the time to aid compliance. So I think it's, and Barry will talk about this later, it's that right person, right time, right message is absolutely key. Okay, so I hope that makes you understand a little that these conversations are happening and you cannot afford to ignore them. The question of regulation. The fear of getting into regs issues we find with lots of our clients often puts a brake on social media. What we tend to say to our clients is be really focused on the message and the strategy for social. If your communication is engaging, creative, and connects on an emotional level rather than on a selling and product level, you will automatically avoid many of the bear traps. But of course you must be aware of the regs for your particular sector. Obviously, pharma is more conservative than, say, OTC, of course. The danger point we've found often comes from a speed of response that's demanded by social media, especially if there's a crisis or a problem. And one of the things we always say to clients is have a social media team internally that understands your overall strategy and make sure you have some sort of a policy or a map in place with how to deal with social media responses that everybody in the company buys into. We would always say, and again Barry will talk about it later, pre-planning for any eventualities can help to neuter this threat of getting into hot water with regs. Okay, so that's just a little bit of background on social media and healthcare. So I'm going to hand over to Barry now, who'll take us through the 6 key considerations when developing a social media strategy. So hopefully this will be seamless as I hand over to Dundee.
Absolutely seamless. Thank you, Zoe. Zoe's right. The key aspect is that you can't sell and you need to emotionally connect. You need to tell a story. But in order to be able to tell that story, you have to understand what's going on. And the key component of any conversation is listening. You need to start by listening. What's being said, who said it, where are they saying it? So there's a couple of tools that we can see on the next slide that can help you try and understand the conversations that are taking place. Who's saying what? Where are they saying it? What type of language are they using? Phraseology, positive and negative sentiment. Who are they engaging with? How much are they sharing? What type of content are they sharing? By understanding all of these key components, by listening to what's going on, it helps you effectively mold part of the strategy. Now, there's billions of conversations that are happening on a daily basis, as we can see on the next slide. Some involve you, some don't involve you. Some are directly involved, some are on the periphery. You need to be able to analyse what's going on with these conversations so that you can understand effectively where you need to engage and just what you should be monitoring. So that's nice, and we can see dramatically how the conversations are shaped. But let's put some faces on that. Who are these people? What are they saying? Where are they saying it? Who are you monitoring? How are you monitoring? Do you know what's being said? Is it noise? Is it good? Is it bad? Is it indifferent? Is it about your brand, your product, your service? Are you allowing others to be the voice for your brand? It could be competitors. You do not know. That's why it's a critical component. And you will hear the word critical used throughout this webinar today. It is critical that you listen. Without the listening and the monitoring, you cannot effectively understand how you should be engaging. So what type of conversations are happening? Well, more than you probably would think. So as we can see on the next slide, it doesn't matter if it's side effects, colostomy, IBS, or instead of the initialism, irritable bowel syndrome. You know, over 2,000, and this is only on Twitter alone, over 2,000 tweets in the last 30 days for colostomy. If that's your product, your service, your area that you're involved with, you should be listening to those conversations. Now, as we explained, that's just Twitter. If we looked at Facebook, if we looked at Pinterest, if we looked at LinkedIn, if we looked at Google+, there's conversations happening on all of the social platforms, and you have to listen to them all. You can't listen to just one. We can see on the next slide that diabetes, aspirin, eczema, no matter how obscure or private you might think that the conversation is, the topic is, it's taking place. People are very, very open on social platforms. The majority of people are more open on social than they would be with family or friends, especially if it is a topic where they might feel a little uncomfortable talking to family and friends. They talk to their online friends, the people that they've not met in real life. And they have these conversations and they seek advice. And it is on open platforms such as Twitter and Google+, and sometimes it's in closed communities and closed groups. Again, you can effectively engage within these closed groups and understand what's being said and then how, most importantly, you can engage. That's the key aspect to listening. You do the listening to understand how the potential to engage is, because you need to plan. It's critical to plan, and one of the critical components to begin is the listening. By listening, you can start to put a spotlight on what's being said. You can start to visualize the conversations and the people who are engaged in the conversations. You can track the conversations. Does it move from an open Twitter discussion that someone may storify so that other people can become involved in, and next minute there's a Facebook group, private group created for it, or there's a Google Plus community created for it, because that's how these private communities where people can talk about some of the more private situations that may be involved with, such as colostomy, they start open and they can end up private. You can analyze what's going on. You know what's happening. That's the critical component. You understand, and that allows you to shape. If you understand everything that's going on, you can shape the future. You can shape your social media strategy. You can shape your social media policy. It's a tough job. It's a very tough job, but there are a few tools out there to try and help you do it. And I say few with a pinch of salt, because this is only a couple. There are hundreds of tools. Some are free, some are paid. Some are very easy to use, others are a little bit more complicated and more intricate. And again, it depends on what you want to record, how you want to record it, and how you're going to use that information as part of your engagement process and your engagement strategy. But all of these and social media itself can leave people feeling lost and confused and unclear, disorientated and bewildered. Sounds like side effects for some drugs, but that's how social media and tools can make people feel. And that's why it's imperative to understand, to listen, to evaluate and to plan. Planning allows you to create your social media strategy. If we just jump straight ahead, so planning is key. Many marketeers are solely focused on the how rather than the why of social media. And for healthcare, the listening stage is imperative, as I've highlighted, so that you can identify the specific opportunities and the specific threats to your brand value, your brand position. What's being said about your brand, your product, your service, and how you should engage. Plan. Plan the social media policy, plan the social media strategy. Planning allows you to then understand how you should get involved. You know, whether it's a compliment, whether it's a complaint. You know, as Zoe said, you have to stay within the guideline, the regs that are very structured within the healthcare vertical. If you know the regulations, which you do, and you have effectively listened, evaluated, analysed and created the forward-thinking plan, you can get involved in the conversations, the open conversations. You know how to respond. You know how to respond positively, and you know how effectively to move that conversation that's happening in an open social sphere to a more private channel if you feel that it's going to be derisory to you being in that open channel. So, by understanding all of the aforementioned, you then know the fields that you need to play in, which is the paid, the owned, and the earned media. All three aspects are critical to your success moving forward as a brand online, in search, social, PR, through 2014 and beyond. Social is a signal. It is not a critical ranking factor yet, but it is a signal. And you have to be involved within that signal, and you have to know how you can use those signals and who you can engage within those signals to push your brand message, your brand value, your brand proposition, your product, your service forward. You have to use each of the channels because no one consumes their information in one area. By using your own channels, you can push your message. You can create your brand ambassadors, your brand affiliates. In fact, they are the immune system for your brand online. They will protect you when conversations start to happen around your product or your service because you have built up trust. You have built up credibility because you have identified, you have engaged, and you have put the right content to the right people using the right channels. So, what does success look like to you? That is the critical question. No two social media policies, no two social media strategies, no two optimization strategies are the same. Success is different for every single company, every single brand. You have to be involved in that conversation at the outset. What does success look like for you? What are you going to measure? How are you going to measure that? Are you going to measure it with figures such as follower growth on Twitter? Is it the number of likes that you receive on a piece of content published on Facebook? Is it the number of pins or repins on a platform like Pinterest? Is it the community that you can grow on a platform like LinkedIn? The number of followers and circles that you have on Google+, and indeed the communities that you can build on Google+. Understand what the metrics are. The publishing volume that you're going to create. Are you going to measure referral traffic? Are you going to use Google Analytics for that and set up some UTM codes on each of your links so you know where that traffic is coming from and you can tie it down? What are the click-through rates on the type of content that you are producing and on what platform are you publishing that? Understand the metrics that you want to measure success against and what does success look like in the future. Where do you want to be? This then allows us to think about how we optimize our sites for social. We create the social media policy, the social media strategy, but we need to engage within each of the platforms. We need to build the audience. Audience is the wrong word. We need to build the community because that's what we want. We want a community of people that we don't sell to, that we emotionally involve, that we tell a story to, that we engage with, that become that front line. The other aspect is how the site then reacts with social. So users of websites tend to be inherently lazy and we have to make it easy for them. So whenever we produce that good content that's delivering the right message and the message that we want to convey to the people who we want to engage with, we have to make it easy for them to share that. So we have to get the appropriate sharing icons. But we have to compel them to share that. We have to engage them to share that. Give them a reason. It has to be a call to action within that content that allows them to do so. Over and above that, the search engines, and I use search engines in a loose term because whether that's something like YouTube or LinkedIn or Twitter or Facebook, which are all content consumers also and present content to the community, they interpret the content that you have on your site, the content that you share in different ways. There are indeed ways that you should mark up your content appropriately. So schema and semantic markup can be used on the site to allow the search engines to analyze the type of content and how they should process that and how they should share that. You have Twitter cards and you have the Facebook Open Graph. You have markup for LinkedIn, and you have schema and RDFA for Google, for example, and also for Bing. You have to make sure that the site is socially optimized so that the content can be shared in the right way. Because if the content is not easily accessible, easily consumable, and easily shareable, the content strategy is failing before it's actually had the opportunity to succeed. So, what to say and why you need a dynamic editorial calendar. You have to understand that content is critical. Content is the lifeblood that it is built on. Content is what the search engines will consume. Content is what your consumers, your audience, your community will consume. That is why content is critical. You can't have the content marketing strategy, the marketing strategy going forward unless you have the right content. And it's about creating shareable, informative, compelling, engaging content that people will want to use, will want to share. It has to be high quality, and it has to have a reason for those people to engage with that content. The content editorial calendar allows you to focus. It allows you to help understand what the audience need, when the audience need it. If you can build up that community knowing that you're going to publish a really good piece of content every Tuesday morning at 10 a.m, your brand ambassadors are waiting for that content. They're ready. They want to consume it at Tuesday morning at 10 a.m, and they want to share it thereafter. The natural life cycle for a piece of content that's produced like that, it's about 48 hours where the general spike takes place. There is a differentiator between fresh content and evergreen, but about 48 hours is the real spike period for any piece of content. That's why an editorial calendar helps, because people are ready and willing, and you know you're going to get the maximum value from it because the audience are there to share it with you. It helps you understand them and produce the right content for the audience. It helps you drive internally the team to engage, to create the content, to distribute the content. It helps you create those loyal brand evangelists. It helps you build the expectations within the audience, but mainly it gives you focus. Because if you stop producing the content, if you stop delivering the message, if you stop engaging with the audience, those metrics that you may have identified back at the planning stage are going to be seriously impacted. They will stop following you, they will stop engaging, they will stop sharing because you're not giving them the information that they need. It's all very well in creating the compelling content, building the audience. We've already set out what we believe success looks like, and we have the metrics that we want to measure against. But we need to analyse. We need to analyse and know that it's working. Know where we can learn from the strengths and weaknesses and where we can evolve. Analysis sometimes does mean death by data. And that's what we want to avoid. We don't want death by data. We know what the success metrics are. What we want to do is identify the weaknesses, the opportunities and the learnings against those metrics of success, against the KPIs. We don't want the project just to run away with us and become a bull in a china shop. We have to maintain focus. And one step back with the editorial calendar, it allows us to maintain that focus. We know not every single piece of content that we create is going to be that killer piece of content. That is impossible. However, by understanding the audience, the community, we can keep them on side by giving them the right content on the right platform at the right time, and we can always build those really strong pieces of content through it. Now, there are tools that will, again, help us to try and understand this. So similar to the tools earlier on, there's quite a number that allow us to evaluate, to measure what the success is, whether we're measuring it by shares or likes or retweets or plus ones. But you have to understand what you want to measure and how you're going to measure that success so that you can extract and extrapolate the right information to analyse and allow you to move forward and not get caught up in that death by data. So, content is absolutely critical to your social media strategy and how you engage with people. You have to have a social media policy clearly outlined about how you will engage, how you will react, the times that you will react in, who will react, and where you will allow that conversation to happen and to continue. Planning is critical. So at that point, I'd like to hand you back over to Zoe.
Much
Unmuted.
and almost to time too. I think we've just got a couple of moments left. We have had a question in and we've just got time to just answer one, I think, which was, Barry, it's really back for you, this one. It was a question to say that we understand how Google likes social and is now putting more thumbs up in terms of social posts, people getting involved in that, and it's really critical for sites to get involved with that. But obviously, in light of latest updates, how are Google feeling about social now?
Yeah, so there's been a number of updates. In fact, there are on average 2 updates to Google a day, and it has been for the last 3 years. The majority of updates that happen, we don't really see. Google chooses to announce certain updates, and the most recent one that they announced was Hummingbird, in line with their 15th birthday. Now, Hummingbird was the biggest update since Caffeine, which was back in 2010. There's been a lot of misinformation flying about what Hummingbird actually is and how you should move forward in a post-Hummingbird environment. Google's understanding the social factors, the social signals. So the social signals are imperative and they need to be part of your strategy. Google is looking to become much more intricate, clever and complex about how it interprets and how it understands the query that the user is putting out there. Now, because of the growth of social and the growth of social engagement, people now treat search engines like they treat social. So when we're talking socially, whether that's with our friends in a room over a glass of wine or whether that's online social, we talk much more in a conversational style. And that's one of the key aspects for Hummingbird. It's understanding that conversational style. Hummingbird wants to understand the semantics, but it's applying the semantics behind the scene. It's not applying it to the result. It's applying it to the search query as the query happens. But conversational search has become something much more prevalent within Google. So understanding the relationship between searches as well. So social is a critical aspect of any strategy going forward. Understanding how people speak socially and how they engage socially, and you have to build that into the strategy. So in short, Google's looking at it very, very closely, and you have to be involved in that conversation.
Okay, that's great. Thank you, Barry. I hope that answers that question. We have run out of time now, but as Ian said, this webinar presentation will now be bundled up and put onto our Foundry Healthcare YouTube channel. Thanks very much for attending. Thanks, bye.